¿Cómo estás, mamá? ¿Bien? Muy bien. Señor, what's up? ¿Cómo anda?
Bien. For single mom Carmen Escobar and her children Lupe and Leo, a trip to the Healthcare Network's Children's Care Office in Golden Gate City is more than just a health checkup. Leo gets regular treatments for a chronic joint illness that, without the persistence of Dr. Jorge Camina, would have likely gone undiagnosed. But like the more than 40,000 Collier County residents a year who visit the network's physicians, this family will receive not only state-of-the-art primary care from Dr. Camina and his staff, but access to other needed services as well.
I think the biggest help that we've been to Mom, if anything, has been just being there. The mom has other issues on top of Leo, social issues that affect her daily life. Not that we solve it, but we point her in the right directions. We give her some of the resources that we can, whatever little we can help, and we get the job done.
Since its founding by community leaders more than 35 years ago, the Healthcare Network has evolved into an organization that embraces the concept of a patient-centered medical home, an integration of biological, psychological, and social sciences aimed at both prevention and treatment of illness. Simultaneously, the organization has grown from one small Immokalee operation to 12 offices spread throughout Collier County, plus the Ronald McDonald Caremobile, to treat patients from all walks of life, both insured and uninsured.
Well, originally the patient population that we cared for was the migrant farm workers in Immokalee. And when I came there in 1980, that was almost exclusively all that we cared for. Over the years, there's been a natural progression to expand our targeted population to really treat anyone and everyone who has an access issue.
Of the more than 40,000 patients a year served by Healthcare Network, more than 30,000 of them are children. It's the largest of the network's 4 main service areas: children's care, family care, women's care, and dental care. Dental care is a good example of how Healthcare Network provides not only needed medical care to underserved populations, but also how that care impacts the community as a whole.
The funds that come to the Caremobile especially, most of them are to provide dental services and vision services to the children in the community that would not get glasses or dental care otherwise. And it's a big, important need for these school-aged children to be able to learn and to succeed.
Strategic partnerships with these organizations, local hospitals, and other private medical care providers allow the nonprofit Healthcare Network to maximize the services it can offer while minimizing the costs of providing those services. The partnerships also keep Healthcare Network at the leading edge of medical care. For example, 3rd and 4th year medical students from Florida State University's medical school work with network physicians in Immokalee to provide women and children the very latest in healthcare treatment. Beyond the partnerships, the state-of-the-art electronic record keeping, the modern facilities, the innovative treatment methods, you'll find what is perhaps the most important ingredient in the success of the Healthcare Network of Southwest Florida: a medical staff that truly cares about its mission and the patients they serve.
It's all about passion and love. Everybody that works here, the doctors, the assistants, the receptionists, they all try to have the utmost customer service.
Healthcare Network is supported by a combination of patient fees and reimbursements, federal grants, and generous philanthropic support from local individuals and organizations. Audited results show fully 96% of the budget goes directly to patient care. Since 1977, various members of the local community have volunteered their time to promote the mission of the Healthcare Network, which is to provide a quality healthcare home accessible to everyone. Visit our facilities and chances are you'll meet someone like high school student Nyla Gutierrez, who, with the help of Dr. Camina and other Healthcare Network professionals, beat back the childhood obesity epidemic sweeping our country and lost 50 pounds, and is now helping other members of her family lead healthier lives as well.
If you really believe that a healthy society is important, if you really believe that healthy children are important, we're the ones that see the most of it. And any help that we can get is going to help us provide better services for the future of our society.